First, I want to introduce myself, and my name is Sean Skelton, and I'm very real. And unfortunately, this is also very real.
You know, it takes like a minute, solidly a minute or 2 minutes of explanation for some of these things, whereas the myth or the misconception you can say in like 2 sentences.
We have a tool that can really prevent this and really make a difference. And the fact that that's not enough for the public, even though that's kind of what people yearn for the first year that we dealt with this. Now we have it, and that's not enough.
Just in the month of June this year, 2021, the United States was averaging about 11,000 new COVID cases a day, okay? Now, fast forward, today is August 7th, and we are now averaging 100,000 new COVID cases a day. Quite alarming.
The only thing I could do is lay on my stomach so that I could breathe. I can't wait to go home.
To go get vaccinated. I'm gonna get vaccinated also.
Please wear your masks. This stuff is real. It's scary. It's not over.
We've been fighting for our life. Yesterday I had to have a conversation about how long to keep her on a ventilator. This is an event that happened to us, and it's horrible. Delta variant COVID is destroying my family.
So now, because cases are once again becoming out of control, the mask mandates are being reinstated. The amount of people who are getting vaccinated is not enough to help the public. So this lack of urgency from the public is once again leading to hospital overwhelms with limited beds and staff. Like, quite literally, you guys, there is no room for people to even go to hospitals at this point. So if you had like a regular chest pain right now that had nothing to do with COVID, I would truly hope and pray that they would have space for you, because it's not likely. And doctors are constantly coming out to the public asking for help, and it's like talking to a wall right now. People just aren't quite getting how serious this is, because it's not close enough to home for them. I've had COVID. I don't want you to feel that it needs to be so close to home to take it serious, because obviously, as we're seeing, there are a lot of people who are getting the Delta variant and regretting not being vaccinated. That's not the time to take back your words, and I would never wish that on any of you. On top of that, medical staff are overworked.
I was just notified today from my job that all nurses are required, and therapists are required now to see COVID patients. I love my job. I love helping people. I've been doing this now for the last 16 years, but I cannot do it again.
And I'm sure right now this is a really traumatizing job for them, to have to constantly deal with COVID cases. By the way, COVID patients do not recover quickly, so that's a part of the issue with the hospital overwhelm, is that they're taking up beds, and they're taking up beds for a long time. Not all of them are, especially the unvaccinated people, are recovering as well as they would like to. So it's very scary, and as someone who has to care for these patients, you can imagine what this is doing to their mental health, and you can probably imagine the compassion fatigue, just all of the emotions that they might be feeling. But honestly, we will never understand. If you care and if you want to help alleviate this massive wave of cases coming, please consider getting your vaccination as soon as possible. And if you have concerns, my first and foremost recommendation is to contact your doctor. And if they don't think that you can get the vaccine, they will let you know. But other than that, to just assume that you don't need to be a part of this is dangerous at this point.
When you get your first dose, you will get a $100 incentive. $100 for any New Yorker.
They're literally paying people to get the vaccine, y'all. Like, help them out. Help them out.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that? Injection inside or almost a cleaning.
So as you can see, misinformation spreads just as quickly, if not faster, than the Delta variant, okay? Every Tom, Dick, and Sally is on Facebook right now with some alleged background in science when I'm pretty sure they could not pass middle school biology today if we gave them a test. Why are we taking all of these things to heart that people say? I don't think there's ever been a time in our history, or at least while we've been alive, that Americans have discredited and disregarded experts, professionals, doctors, the people who are paid to help us through these situations when they arise. We have never done anything like this, and I think a big part of that is social media. We shouldn't be listening to politics. We should be listening to professionals, medical professionals, okay? This is dangerous. So I'm gonna share my platform with two very special people who can speak better to all of these things than I can. I recognize my position as an influencer, and because I have this platform, I'm so thankful that I can use it during these times. So today I'm gonna bring in Dr. Nock and Holly Cardillo. So Dr. Nock is a really cool scientist who has been bringing a lot of information to the public in very entertaining, digestible bits.
It's not going to get much more clear than this. In the month of May in the United States, there were about 18,000 deaths from COVID-19. Only 0.8% of those were in people who were fully vaccinated. More than 99% of the people who died from COVID last month were not fully vaccinated.
I think we can all agree that a lot of people use fear-mongering and just these fearful tactics to share this information, and I don't think it needs to be that way. And he does it in a really amazing, straightforward, yet entertaining way. So if you're not following him on TikTok, I'm gonna leave his socials down below. Definitely give him a follow. I think we need to be filling our feeds with more people like Dr. Nock. I'm also bringing in Holly today, and she's actually one of my dear friends. And Holly is an emergency medicine physician assistant. As I mentioned before, I will never be able to fathom what it's like to work on the floor so closely to COVID patients, and I will never understand what they see on a regular basis, but I have learned so much from listening to my friends who are frontline workers. And so I wanted to bring Holly in today because I think her perspective, it's very real and it's very raw, and I think a lot of you will get some value in hearing from her. All right, so without further ado, let's bring in Dr. Nock. All right, well, hello, Dr. Nock, and thank you so much for being here today. Before we jump in, can you just give us a brief introduction about who you are?
Sure. Yeah, so my name is Dr. Nock. I'm a scientist who studies COVID-19. I work on developing therapeutics actually for respiratory disease, including COVID, but then including things like influenza, RSV, other viruses as well. And so since the beginning of the pandemic, I've jumped out of the sort of lab scientist role, and I've been making content on social media to educate people about, these are the scientific facts about COVID, or about the COVID vaccines, or about COVID treatments, to try to combat some of the, diversely true information that is across the internet right now. It can be hard to tell the difference though, if you don't have a background in science, who knows? Some of these things sound very true. They may sound pretty scientific, and it can be tough to discern the difference between truth and just absolute myth.
I have some concerns that were directly sent to me from my followers and some myths. So I thought we would maybe start with these myths. First one I have is that the vaccine only lasts for 3 to 6 months and that you will constantly have to get boosters for it to keep working.
So not true, but there's like a tiny sliver of truth in it. And so the origin of this, this claim online is that for a while, we only had data through 3 months after vaccination. And so there was data that came out that said up, through at least 3 months, and then later at least 6 months, you have good levels of protection against COVID. And so that was, through some outlets, misinterpreted as only 6 months instead of at least 6 months of protection. The reality is, what we are seeing is that people have strong antibody levels over time. They have strong T cell levels over time, lasting longer than 6 months. And so we basically just have to wait and see how long it will last. Probably at some point we will eventually need a booster, particularly with the development of new variants. It doesn't look like we've gotten to that point yet. Maybe, in some populations, like patients who are immunocompromised for some reason, or patients who are super high risk for COVID. Maybe in those select cases, we could be getting close to needing a booster for things like the Delta variant. But, to broadly say that after 6 months, it's not working anymore and you need a booster, that's not quite correct.
Good to hear. Definitely brings some peace in that area. So another common one that I was seeing was that a lot of people just do not trust the vaccine because it was made too quickly.
Typically, it takes a long time to make any therapeutic or vaccine because you do it stepwise. You do, the preclinical testing, you do phase 1. If phase 1 looks good, you spend a bunch of money to scale up for phase 2. If that looks good, you spend a bunch of money to scale up for phase 3. You don't scale up for phase 3 right away because you don't want to waste a bunch of money if it doesn't work in phase 1. What was very different about the COVID vaccines is the government was willing to say, don't worry about holding back financially, just scale up, assuming we might need it. Not skipping any steps, but skipping the time lag in between steps that would normally happen due to, investment concerns. The second thing is vaccine trials. They're still ongoing for the COVID-19 vaccines, which is confusing for the wrong reason. So the reason why the trials are ongoing is they want to see how long does protection last. Similar to what we were talking about, is it 6 months? Is it 24 months before you lose protection? The best way you're going to know that is if you continue to follow those patients who've been monitored very closely in the clinical trials over time. And you see eventually at some point, they may start getting infected. All the vaccine side effects that you would expect to happen relatively soon after vaccination. This is true historically for, all vaccines that we have decades and decades of experience with, as well as for the COVID vaccines for an important reason, which is that the vaccines are just not in your body after the first couple of weeks. So like the mRNA vaccines, they go into your cells, they help make that viral spike protein, which your immune system trains against. But then, starting on the order of days, and certainly within a couple of weeks, the vaccine itself is totally gone. You're not making any more spike protein. The only thing that's remaining are the immune cells, which have been trained to fight COVID, and those will stick around for quite a while, which is a good thing. But the vaccine itself is gone. So there's not really much of a plausible biological mechanism where you would be fine for 2 years, and then at 2 years and 1 month, all of a sudden, something happens medically. It's not feasible biologically, and so that's not why the clinical trials are going on for 2 years.
That makes a lot of sense, because I could understand, I think, even like a lot of my family members were saying that one, and I never really had like a good explanation to ease their minds, but just like, I don't trust it, it's too quick.
It takes like a minute, solidly a minute or 2 minutes of explanation for some of these things, whereas the myth or the misconception you can say in like 2 sentences. Right. And so there's this big imbalance where you can spread the misinformation like very easily in a tweet, but the answer for why it's not a concern takes a while.
That's
you have to have like some attention.
I never thought about that. And I think that also goes for just researching from credible resources. It's so much easier to see the quick tweets and all those things versus like taking the time to read like what the CDC is saying and credible sources. So yeah, there's an imbalance there for sure. A lot of people were concerned that the vaccine messes with women's menstrual cycles.
So not an obstetrician or gynecologist, obviously. What I can speak is sort of my understanding is that there are a range of things ranging from infections to stress to rapid weight loss or weight gain that can cause temporary effects on menstrual cycles, including sometimes vaccinations. The exact mechanisms by which it happens, I'm not 100% sure, whether it's your body's like inflammatory response and it thinks it's infected because it's responding to the vaccine or something. Basically, your body thinks it's stressed for a short period of time, which certainly can cause short-term changes in menstrual cycles. My understanding, though, is that it goes back to being regular. It's certainly not an indicator of any impact on something like fertility. Typically, we do associate menstrual cycles with fertility, for example. And so if you see an irregularity in menstrual cycles, it may be logical to think, what does this mean about fertility? But I don't think there is actually any necessary link between the two things. Anything that could be a stressing event or cause short-term inflammation could impact menstrual cycles in the short term.
That makes a lot of sense. And so I had like another one that kind of feeds into that, where you kind of just touched on it with like fertility, that the vaccine has long-term effects on fertility in men and women. So kind of the same thing there.
Right. Yeah, not the case. And so the American College of Obstetricians and Gynecologists now, as of last month, is recommending broadly as the default decision, for example, in pregnant people to get vaccinated against COVID. And there's sort of 2 reasons for that. One is your risks of severe disease outcomes if you're pregnant are increased. So a lot of sad cases of pregnant people, being hospitalized with really severe COVID, and it's causing bad things for the pregnant person and for the child. Well, there's clearly a need for protection, but can you vaccinate safely? And so to answer that question, there have been tens and tens of thousands of people who are pregnant who have received COVID vaccines. If you look at differences in adverse outcomes for the pregnant person or for the child, comparing people who got the COVID vaccine against, the rates at which adverse outcomes sort of happen during pregnancy, there's no difference. There's no elevated risk relative to the risk that you would expect sort of in the population. That's a little bit different than fertility. For men, for example, there was a good study out of University of Miami where they took semen samples pre and post COVID vaccination, and they were evaluating those semen samples for, like how motile, how well can the sperm swim? What is the volume of semen? The factors that you look for to assess fertility in a semen sample. And basically they saw no differences pre and post vaccination. They even hinted a little bit they're like, the reason why we did the study is because people are concerned about it. That combined with the fact that there have been billions of vaccinations given by this point. If people were not able to have children, we would know about it by now.
Very, very true, you guys. Okay, so you hit the pregnancy one. I don't even know if we need to ask it at this point, but breastfeeding was brought up. And so I guess if they're able to get the vaccine pregnant, then breastfeeding is totally fine.
Good question and right answer. Yeah. In fact, there's some big benefits that we haven't talked about, which is if the pregnant person has been vaccinated and they've got antibodies against COVID, they can actually pass it on to the child through the placenta. And then after birth, if they're breastfeeding, they can pass antibodies through breast milk to the child. And then when they drink the milk, basically those antibodies end up just coating, your mucosa, and they actually give you decent, it's not as good as having your own immunity. But for the kid, it's decent protection. Wow. Yeah, but no risks associated with it.
Okay, this one, I can definitely I think out of all the myths here, this is the one I was like, okay, that's a good point. So the CDC hasn't approved the vaccines, and right. A lot of people claim that therefore it's not safe. So
FDA, they have given emergency use authorization to the vaccines. They are currently evaluating it for full approval, basically. Last I heard, it's estimated that they'll be done reviewing it for full approval by basically September or October. But it is the same regulatory body. It's the FDA who is saying, yeah, the benefits dramatically outweigh the risks. You should get a COVID vaccine through the EUA. That's the same people who are evaluating it for full approval. So the reason for the difference between those two things is for what we have right now, which is EUA, they evaluate a median of 2 months of follow-up data on COVID vaccine. The requirement for full licensure is 6 months of safety and efficacy data of follow-up. They just had to wait basically until they had accrued 6 months of data, and then they submit this huge data packet to the FDA, hundreds and hundreds and hundreds of pages. And understandably, they want to pour through every single piece of data so that when they do make that final determination, they're 100% confident they haven't missed anything. We're going to see it, probably not for a couple of months, but I would be very surprised if they didn't give it full approval.
Okay, so you think definitely by 2022, we would see that FDA approval?
Right.
Okay, so just be patient, guys, it's coming. Then I have another one that is people with the vaccine are still getting the virus, so it's useless.
So this is a good one. There's a little bit of truth in that you certainly can still get infected if you've been vaccinated. My favorite analogy by far is the seatbelt analogy, where some people who wear seatbelts get into car wrecks and may die in car wrecks or something. That doesn't mean that seatbelts don't help. It doesn't mean that they reduce your risk of severe injury in the case of a car wreck. With vaccines, it's very much the same thing. Certainly, they don't work 100% at preventing infection or preventing severe disease, but they do reduce your risk. Whether it's reducing your risk of infection by half, if it does that, that's a good thing, but still a bunch of people will end up getting infected. 9/10 of people will be totally fine, but 1/10 of people may still get hospitalized, which is not great for those people, but it's better than 10/10 of people getting hospitalized. We do see very clear benefits of the vaccines, but they're certainly not perfect for sure.
Yeah, so it's that extra layer of protection, but it's never 100% guarantee.
Yeah, it's the difference between, if we had 1,000 deaths from COVID per day, maybe if all those people were vaccinated, maybe we would have 100 per day or 50 per day. I don't know exactly what the number would be. If you're cutting it down 90%, that's hugely beneficial. It reduces the strain on hospitals, reduces the strain on healthcare providers, saves a bunch of people.
Well, great. So that kind of wraps up the portion of the myths. Now I'm moving into more individual concerns that some of my followers had, so I'll share those with you. I've had blood clots and should not get the vaccine. So what are your thoughts there?
Not an expert in hematology, but my understanding is that, the type of blood clots that they may have had previously are unrelated to the type of blood clots that can happen with and the only one that it's really relevant for is the J&J vaccine. Super rare events where some people who got the J&J vaccine did get some blood clots that appeared to be related to the vaccine. That type of immune activation mechanism is unrelated to the more common types of blood clots that people might typically have. And so my understanding is that having a history of like those other types of blood clots doesn't necessarily mean you have increased risk of the immune type of blood clots from the vaccine. This is part of the difficulty, is there are certainly real risks of the vaccines. 1 in 100,000 people may experience anaphylaxis, or 1 in 50,000, I'm not sure the exact number, which is bad, super uncomfortable. It's treatable, most people end up fine, but like the vaccine can cause serious allergic reactions. So it's weighing that against the risks of COVID infections, which are orders of magnitude more dangerous. And so it's that benefit risk comparison that I wish it was a black and white answer where the vaccine is totally safe and 100% effective and COVID is, not safe at all, obviously. It's not, it's a little bit gray, but it's not 50-50 gray. It's like 98.2% gray.
I guess if, someone like that has concerns, would you just recommend that they take it up with their doctor versus kind of that self-diagnosis?
Oh yeah, absolutely, for sure.
Someone said that they have undiagnosed health issues, need to get a green light from a doctor, but don't currently have the financial assistance to do so. So do you have any advice for someone that might be in this kind of position?
It's super challenging without, any details, obviously. What I will say is that there are very, very few health conditions that would make a doctor say, don't get the COVID vaccine. Not really many are coming to mind, other than if you know that you're allergic to some vaccine components or you have a history of allergy to something contained in the vaccine. Generally though, things, like heart disease or diabetes or a range of diseases that predispose you to increased risk of severe COVID don't predispose you to increased risk of vaccine adverse events in the vast majority of cases, in everything I can think of. And so it's tricky because ideally you would want to confirm that with your doctor. If you don't have a doctor, you should still confirm it. You can talk with a pharmacist. Largely, they'll be willing to discuss any concerns you have. You may be able to tell them specifically, I have this health concern or this health concern. Do you think that means I should wait on the vaccine or not? And they may be able to give you a bit of an answer if it's very clear to them, or they may say, no, I can't really help you. You really do need to speak with a doctor.
This one is kind of asking, of all the vaccines, is there a vaccine that has the least amount of side effects?
My recommendation would be to go with one of the mRNA vaccines, if you have a choice. They certainly have a risk of side effects. They will go away within a couple of days. A pretty good fraction of people do have some degree of fatigue or arm soreness or fever. There's not going to be a circumstance where you can say like, oh no, I'll have no issues. But in terms of the mild to moderate types of side effects, like those will happen. Most people aren't too bothered by them for the first couple of days and then they go away. In terms of like serious side effects, super rare. So even with the mRNA vaccines, if you happen to be allergic, it's uncomfortable but treatable.
So when you say mRNA vaccine, which ones are those?
Right, good question. So that would be the Moderna or the Pfizer.
Okay, perfect. And yeah, you guys, I actually had Pfizer. So if you're curious on my experience, I have a 2-part video series on my channel where I show you everything that happened. I had the arm soreness, the fatigue and everything, but I was an open book about it. I'll link those down below so you can see my personal experience if you're curious about that as well.
I had Moderna and I certainly had a fever for the night after my second dose.
Really?
I had like light sweats, but then I woke up and I was totally fine. So
yeah, that was me too. It was like a day of kind of feeling the side effects. I got the shot and then it just hit me. I was out. And honestly, I was like, hey, I just got to take a 14-hour nap. So if that's the worst of it, then I'll take it.
If you can line it up where the day afterwards, you don't have too much, at least in the morning.
Yes, that is a great tip. Try to make sure you don't have a lot going on.
And I should say, so, I said my preference would be for the Moderna or for the Pfizer. J&J is also substantially helpful and like way, way better than not being vaccinated at all. And it only requires 1 vaccine instead of, 2 injections. It's a pretty close race between Moderna and Pfizer and then J&J. Those are like leagues above not being vaccinated at all, for sure.
Absolutely. Something is better than nothing. Okay. So someone else said, I've had COVID twice. I'm worried how I will react to the vaccine after contracting the virus already.
So good news for anyone who has had COVID and is considering vaccination by far the best case scenario for immunity is if you've both had COVID and gotten at least one dose of a COVID vaccine.
Oh, I've had both.
Okay, then you're set. That gives you like the strongest coverage against variants, highest levels of neutralizing antibody titers, good T cell protection, and there is not an increased risk of like vaccine reactogenicity if you've had prior COVID. There's actually a cool study that came out of, I think it was out of Kentucky just yesterday or a couple days ago, that was comparing the relative protection you get from having recovered from COVID versus being fully vaccinated. And certainly having had COVID before does decrease your risk of being infected. It does decrease your risk of, hospitalization and stuff. But being fully vaccinated was even a little bit better. It was about twofold better in terms of decreasing your risk of infection. Now, the combination of both is like even better than that. And part of the reason for that is that when you recover from COVID, there's a lot of heterogeneity across people in terms of what types of antibodies they form, how many antibodies they form. Like two people who had very similar courses of disease can have very different levels of protection after COVID. We don't fully understand why. But some people have very strong protection for 6 months and longer after recovering from infection. Some people have basically no levels of neutralizing antibodies. And so since you won't really know which of those groups you fall into after recovering from COVID, by far your best bet is to get at least one dose of a vaccine, and then you're set.
Okay, here's the last one. So the last one's kind of creepy to me too. This is from a vaccinated follower who, for some context, lives in an area that's very anti-vax. And he decided to, get his vaccine, and it's constant fear mongering among them. And he was being sent these really disturbing videos of people with adverse effects, or claiming, I'm going to say claiming because there's no proof in these videos that that's true, just like the tremors and the shaking, and they're claiming that it's from the vaccine. So how do we dissect that one?
Like you say, over video, it's hard to tell what's genuine, what's not genuine. Certainly, this type of thing can happen after vaccinations, after infections, after some surgeries. This is very much a neurologist's question, which I am certainly not a neurologist, but I can give you sort of my takeaways from reading about it. When you see the types of tremors, that's usually thought to be something called functional neurological disorder, or FND. It's a little bit tricky to explain because when you watch the videos at first, you'll come away with definitely the wrong perception of what's going on. And so it's where, the hyper-stressed state sometimes, or the environment, or hyper-focus on one's body leads to this feedback loop of sort of neurological and psychiatric activity that can result in tremors. And so the takeaway point is that the COVID vaccine is not causing anything biologically or chemically to the body or to the nervous system. The body, like the physical body itself, there's no damage. The vaccine hasn't caused any damage. What's happening is there's almost more of a psychological reaction to the stress of the trigger of the vaccination or the infection or surgery or whatever it is. But it is real. It's not, they're not making it up necessarily. I don't know about the videos, but like it can happen for sure, for real. Usually the treatments are something like cognitive behavioral therapy or physiotherapy, where you're trying to help the people, overcome this neurological psychiatric reaction to vaccinations. It's really hard to explain though, because it's not necessarily something toxic from the vaccine that caused it, even though the act of getting vaccinated can lead to it, in super, super rare circumstances.
And so with cases like that, I mean, you kind of said it's super rare. Is there like a statistic for how common that is?
There's some, neurology association that actually put out a couple of papers on this, like referencing the social media videos. They said, like, we've seen these videos circulating after COVID vaccines. We can't verify because we haven't seen the patients. We think this is what it is. This is why we're not concerned about it, and we still recommend people get COVID vaccines. A video like that is going to go super, super viral, which will make it seem more common than it actually is. If it's happening in 1 in a million cases and 50 million people get vaccinated in a period of time, and you see 50 videos like that, that makes it seem like it's really common, even if it's not.
Yeah, I always tell my followers, keep in mind, like, we're not gonna hear from people like me. I'm an influencer. It's my job to share that, like, I had a normal experience, but no one else is gonna be like, I had a normal experience. But I think, more people are, and we're just not hearing about it. So you have to remember that when seeing these very viral videos that, of course, elicit fear, just to remember that's not as common. So thank you so much for taking the time to do this. It is very helpful and valuable to so many people. So thank you.
For sure. Yeah, and great questions, everyone. I'm glad this is a great experience because, for every person that has this question, there's thousands of more people who share similar concerns and similar questions. So this is what people need to be doing. It's reasonable for people to have questions about the COVID vaccines. Yeah. Particularly with all the misinformation, intentional or unintentional, online. And there are answers. Sometimes they can be hard to find online.
Guys, I'm so glad you got to hear from Dr. Nock. He is seriously the coolest scientist and giving Bill Nye a run for his money. So all of you be sure to go follow him and keep up with the things he's saying. It's very helpful and very important, and he is just so entertaining and helpful. Now I'm gonna switch over and bring in my girl Holly to talk with you guys. All right, so I have Holly with me today, and she's gonna speak to the perspective of people working the front line. So thank you so much, Holly, for being here. Go ahead and give us a brief intro of who you are.
Sure, thanks so much for having me. So my name's Holly. I'm a physician assistant. I work in a somewhat rural emergency department outside of Pittsburgh. So I'm seeing patients independently when they come into the emergency department, ordering the tests that I feel that they need, and then treating them and discharging them with whatever medications or treatments they might require.
Amazing. Well, thank you for all that you do. I know it's a really tough time to be working in that field, so we definitely appreciate everything you're doing. First up, I just wanted to get your perspective on what your experience has been like working with COVID patients right now.
Working with COVID patients has kind of changed and evolved drastically over the last year and a half. Initially, there was just so much fear and confusion, and a lot of healthcare workers very concerned about their own health and the health of their families. I would say right now what's kind of shifted is that there's a little bit of a sense of protection with this vaccine, kind of gave everybody a sigh of relief, especially 6 months ago as it started to make it into arms. And now we're walking this fine line where we feel protected, but this surge again with these new variants is bringing up that initial fear that we had. Are we protected enough? Are our loved ones protected? Kind of what more can we do to ensure our own safety so we can continue to care for patients?
Totally, that makes a lot of sense. And yeah, I think even from the public, we're just like, what direction is this gonna go? It's really confusing and, scary. So what differences would you say you've noticed between like the first strain and the Delta variant that we have right now?
Delta variant seems to be infecting a younger population. I think that's for a few reasons. Speaking to my area specifically, I know as the vaccine was made available to the public, nursing homes and the elderly were just such a huge target nationwide, especially in our area where we have a lot of unhealthy individuals. So the first time around, that's where we were seeing a lot of infections, and then that's where we really pushed to get vaccinated. This time with the Delta variant, I think a lot of the younger crowd tends to be the group that's less vaccinated, so the disease is able to run a little more rampant there. And unfortunately, I also think that's the population that does not want to continue to mask up and miss out and stay home. So there's a lot more crowding and, out and about together. And that's the group that we're really seeing get hit harder this time.
I did not know that. So that's interesting. So would you say like younger crowd being like people our age in their 20s, or is it like younger than that?
20s to 50 maybe. I'm seeing less and less elderly, which is very great because obviously it's, handled better in the younger crowd. In terms of kids, just in my own personal experience, luckily, I'm really not seeing a lot of kids come into the emergency department, at least with severe symptoms, if they do have symptoms.
What are the biggest difference you're seeing then between vaccinated patients and unvaccinated patients?
I do not think I have seen an infected vaccinated person so far, which is wonderful. And I recognize that that's just my own experience, and I really hope that doesn't change in the coming weeks, but it likely will. The vaccine does not prevent infection. Nobody's trying to make that claim. However, in the setting of the emergency department, so we're seeing the people that are more sick, that really feel like they require an emergency evaluation, they have all been unvaccinated. In my experience so far. And speaking to the experience of my colleagues, vaccination has been proven to at least get you a much less severe case. So there's very, very few that will end up hospitalized or on ventilators or anything like that. That should be, less than 0.1%, truly.
Kind of switching gears here to speak more to medical staff. Why do you think so many medical workers are quitting right now?
the entire country, the entire world has had just this tumultuous, awful year and a half in so many ways. It's really shaken up everything that we thought was normal. And especially in medicine, it's really changed what the day-to-day feels like. And I think that there were, like I spoke to before, a lot of people that were very concerned about their own safety, the safety of their loved ones that couldn't afford to get sick, or know that maybe they were the one that brought it home. And there was some people that just got really exhausted by what the day-to-day has become. And now it is kind of a vicious cycle. We're understaffed. So especially in the nursing field, it means that there's a higher patient burden. These patients are sicker. This disease is scarier. And now you're burdened with more patients every shift. And, then that drives people also to back out of the medical field and pick something else. So I think as things worsen, they will start to worsen more exponentially.
Yeah, I don't think anyone could fathom where, you guys would be today dealing with the amount of people coming in. And to mention, you guys have more patients per person now, but these patients with COVID specifically are taking up beds for longer. So do you know what the average duration looks like for a COVID patient coming in and how long they're staying?
Currently, I think things have gotten a lot better throughout the pandemic. We've got a lot more tricks and different medicines, none of which are, proven, but that we're using to try and lessen symptoms. We have different tricks to keep people off of ventilators because that was a huge problem initially.
Right.
But these are longer stays. I don't off the top of my head have exact numbers, but they're longer stays. They're longer stays oftentimes in our ICU. So it's really important to remember that from the very beginning, the goal was not we would love to save every life possible, but that was not the goal. The reason everyone needed to stay home and mask up is because if we overwhelm the healthcare system, regardless of if you're sick with COVID or your loved one has a heart attack or a car accident, if there's not the staff and the resources, because the healthcare system's overwhelmed, we're going to lose significantly more people than if we could kind of take this in smaller waves and not drown all of our resources. And that's part of the problem with this is with longer stays in the ICU, even if it's less people, that adds up every week, every month. And now we don't have beds or we don't have staff to take care of you.
That makes total sense. And that kind of touches on the next point that I wanted you to bring up, which you don't have to reiterate too much here, but how are vaccines helping medical staff here?
So vaccines prevent severe infection, they prevent hospitalizations, and they prevent death. And that is in the majority of cases. So again, they're just another tool we have to keep people out of the hospital, because that way we won't end up without ventilators or without intensivists or without nurses to take care of you.
And then my last question for you is, do you think you can speak to, and we kind of touched on it already as well, but generally the mental well-being and emotional well-being of medical staff workers right now? What do you think the tone is right now?
Tired. I think everybody's tired. Personally, where I work, we surged a little bit later than the rest of the country. So we're kind of a somewhat rural emergency department. As the cities around us kind of got slammed with COVID, our surge was a little bit later, and I anticipate that's how it'll be this time. So right now, there's just a lot of angst and fear of what's probably to come in the next few weeks, and everybody's tired. We've done this now for a year and a half. I also think that there's a fair amount of anger. We have a tool that can really prevent this and really make a difference, and the fact that that's not enough for the public, even though that's kind of what people yearn for the first year that we dealt with this. Now we have it, and that's not enough. It's really angering. And I think another thing that just gets me every time is how many patients find out they're positive, whether they're very sick and requiring oxygen hospitalization, or just finding out that they're positive and they're not going to be able to work for 10 days and need to isolate and this and that. How many people then ask, well, can I get vaccinated? And at that point, it's too late. And it's so frustrating that that's what it takes for this group that's really hesitant on the vaccine, is then they want to, beg for it and change their mind once they're infected. And then we can't help as much. And it's tiring. It's definitely tiring.
I have strayed from any opinions in this specific video, but I feel your anger, and I could not imagine having to, you know, care for patients that have been given the tools and the answers. And it just goes to show how big your hearts are and how patient you guys are. So big kudos to y'all. And seriously, every healthcare worker deserves a round of applause right now, because I can't imagine. So, of course. But yeah, that was pretty much everything I wanted to cover, and I want to thank you again for taking out the time to answer these, and I know that it's going to bring a lot of value to people, so thank you so much for that.
Yeah, and thank you so much for having me. And I just would urge people, I would urge people to get vaccinated first and foremost, but I just would urge people to make sure that the information that you're consuming is from reliable sources, and that it's credible and tested, and it's not coming from Facebook or coming from a family member or somebody else. So thank you again for having scientists and medical professionals on here to just try and break down the barriers and hopefully get more people vaccinated.
All right, well, thanks again, Holly, for sharing all of that information with us. And again, big shout out to any frontline workers. We know how hard you work and are thinking of you during this really insane time. So you guys, I hope that this was super helpful to you, and I hope that it alleviates any concerns and kind of debunks those myths that are just floating around. Please, please, please continue listening to medical professionals and not everyone who thinks they're one. And most importantly, please consider getting vaccinated as soon as possible. Talk with your doctor if you have concerns and get it from them that it's not something or is something that you can get. Thank you so much for tuning in and watching this one. I'll see you guys next week.